Okay, I think we're going to get started. It looks like everyone's on the webinar today. Thank you very much for joining us. My name is Cecily Paulzine. I work in the marketing department at the Mankato Clinic. I have a couple of housekeeping items before we get started. You will be muted throughout the presentation. And if you have any questions, Dr. Finn will be answering a few questions at the end of the presentation, so please feel free to send them through the chat window, and I will moderate those. Today I'd like to introduce you to our presenter, Dr. Thomas Finn. In addition to leading Mankato Clinic's new sports medicine practice, Dr. Finn is also an urgent care physician. He has recently joined us after completing a family medicine residency and a sports medicine fellowship at the University of Notre Dame. He will talk a little bit more about his specialty today. And with that, I'd like to pass it over to Dr. Thomas Finn.
All right, thank you, Cecily. And thank you everyone for joining me today. I know that the COVID-19 pandemic has been affecting all of our lives, and many of us have not been able to do our regular exercise routines. Now that things are starting to open up a little bit more and the weather's getting nice outside, we thought it would be a good time to talk about how to get back into your sports and exercise routines safely and preventing any injury. So starting off, what do we want to watch out for? Get back into our exercise routine. You can go to this next slide here. It's important to start low and go slow. Patience is really important. We don't want to be abrupt increase in activity because that can predispose you to getting an injury. Your body does adapt to the amount of work that you want it to do. It just takes time, but you're building strength in your connective tissues, your bones, muscles, tendons. You're increasing the energy stores in your muscles, also increasing the amount of oxygen that your lungs can take in and the ability of your heart to circulate blood throughout the body. A lot of really amazing adaptations, but it takes time for this to happen. And if you haven't been using it, it also over time will slowly go away. So if your activity levels drop to zero for more than 2 to 3 weeks, it's going to take a little bit of time to get back up to where you were, and you shouldn't expect to be able to jump right back into your regular workout routine. If it has been closer to a 3-month wait, no exercise, really been inactive during that time, a good rule of thumb would be starting out, if you're an endurance athlete, runner, cyclist, starting at about 50% of the exercise volume and intensity that you were doing before this all started 3 months ago. That would be a good starting place. And then I recommend people to increase their volume and intensity of running by about 10% a week. Same thing for resistance exercise, like weightlifting. Probably starting at 50 to 60% of where you were if you truly have been inactive for the past 3 months. And then you could probably progress a little bit faster than if you were focusing just on the endurance aspect of the exercise, but still I would expect at least a few weeks before you're getting back up to where you were before. Now, the good news is if you have been doing some exercise, even just workout a week can make a big difference in minimizing the drop off of all that hard work that you may have lost with the changes that's happening with your body. But so you may not need to drop that low, is what I'm saying, if you have been doing some exercise. Next thing I want to mention is preparing your body for getting back into your regular exercise routine. Getting some core strengthening, easy things to do at home, doing some squats, lunges, hip raises or glute bridges, especially if you have been pretty inactive or sitting a lot more than normal. In the US, we have problems with hunching forward, letting our shoulders kind of protrude, and letting that head rest a little bit more forward than where you would want it straight above your shoulders. Also, if we're sitting for a long time, our hips are going to be flexed for extended periods of time, so you can get tightness in your chest and your upper back, as well as your hip flexors. So that'd be important things to stretch before you're getting back into your exercise, because that's going to affect your posture and technique. And those would be another thing that kind of predisposes you getting injury if you're not moving your body in the correct way. The next important point would be rest. It's really important to give your body time to recover. Athletes with less than 2 days of rest per week have over a 5-fold increase of overuse injury. So make sure you're getting that rest in, especially the first week getting back into activity. Really listen to your body, and you may need more rest than you typically do, but your body will make those adaptations if you give it the time to do so. It's also important to know the safety protocols at your gym. I'd recommend looking that up ahead of time or calling in, asking any questions. A lot of gyms are not having any locker rooms or showers available. They may require you to have a reservation or wearing a mask, especially if it's indoors versus outdoors. And so a good thing to know before you're jumping back in is how that's going to work when you do show up at a gym, if that's where you work out. Going back just a little bit to that technique, I'd also recommend if you are doing more complex exercises, say you're a weightlifter and doing Olympic lifts or something, try to do the complex exercises early in a workout to really work on that form and technique, as opposed to later when their muscles are a lot more exhausted. And then this would also be a good time to think about working with a trainer or physical therapist, especially if you have a history of having injuries or kind of nagging aches and pains when you're exercising. Going to the next slide here, things to watch out for. When should you see a doctor? So if you have any sudden or increasing pain during exercise, if something feels wrong, listen to your body. Stop. If you're out on a run, go back home. Stop at the gym if you really feel you pulled or tweaked something. If you're having excessive soreness, something that's not feeling like your regular muscle soreness, if it's not getting better after a week, or if it feels a lot more severe than you're used to, you're having a lot of swelling in the area, that would be something that I would have you come in and either see a sports medicine specialist or your family doctor. Also, any nagging pains that are either getting worse during your exercise, or they're just not improving. Like I said, after a week or so, stuff should be healing up. Another thing to think about is, if you're not used to working outside, doing that now, protecting yourself from the sun, and also being aware of heat illness. Heat exhaustion, heat stroke are real and potentially very dangerous things. So pay attention to the weather and signs that you could have if you're experiencing any of those issues. Young athletes, especially with the summer and outdoor, make sure you're telling kids to tell their coaches or parents if something's hurting or isn't feeling right, and then make sure that you follow up with their doctor or orthopedist or sports medicine specialist. I think how I would have children resuming sports is pretty similar actually to CDC guidelines with resuming athletics and keeping the social distancing practices up, but starting with an individual conditioning and basic drills, and then progressing to small groups, working in small cohorts before eventually getting back to teamwork. So I think that would actually flow pretty well with the COVID prevention guidelines. Actually, is children are also very likely to get overuse injuries. It's not uncommon for them to get them. They're a little bit different ones than adults can get, but they're also at risk. Next major point that I want to talk about is if you have been sick. So the COVID infection does seem to be different from normal viral infections. Normally, we talk to people about maybe of a neck check. If you're feeling sick just from the neck up, it's probably okay to exercise. But it's not necessarily true for COVID. And the reason is there's a lot more cardiac or heart complications, at least that we've seen in hospitalized patients. And the other reason is that the illness is often worsening after the first week of infection, which is a little bit different than most viral infections. There are two consensus statements that were put out, one by the Lancet, and that was a group of pulmonologists, lung doctors, who recommended resting 10 days from the first onset of your symptoms and then an additional 7 days after your symptoms resolve. The JAMA Cardiology, the Journal of American Medical Association, the Sports and Exercise Cardiology Council, from the American College of Cardiology, also put out a statement recommending rest for at least 2 weeks from symptom resolution or from a positive test if you did not have any symptoms but had a test that came back positive from, say, an exposure. And this is all sounding very conservative, but it's due to the risk of heart side effects potentially from being infected with COVID. I don't expect the first several workouts to feel great after you've been sick, but definitely see your doctor if you're having that aren't gradually improving, or if you're having shortness of breath, wheezing, chest tightness, or feeling fluttering in your chest or palpitations. That'd be something that I definitely want for. If you have been hospitalized, you should be examined by a doctor before you go back to exercise. And I would recommend talking with your doctor, even at a positive test or mild infection. There's also going to be a consensus statement by the International Olympic Committee on exercise guidelines that should be published pretty soon in the near future, so you can keep an eye out for that. Lastly, a little plug for the Mankato Clinic here. If you are injured or having any pain with your getting back into your exercise, we do have a few areas that you could be seen, whether it's coming into the urgent care for something that just happened, or seeing physical therapy. Also, I've started the sports medicine program here. It's called sports medicine, but it's not just for competitive athletes. It's you can think of it basically as a non-operative orthopedist, or basically musculoskeletal problems with your bones, joints, tendons, muscles. In addition to that, there's also other issues that come along with exercise, concussions, breathing or respiratory issues. Like Cecily said, my background is family medicine, so there's a lot of different issues that could be affecting people who are exercising. What part of my specialty does is discerning non-operative from operative treatments and focusing on the non-operative treatments for your injuries or pains or what have you. The musculoskeletal ultrasound is a imaging modality. Most people are familiar with ultrasounds, and looking at babies that way, but that's also very good at looking at the musculoskeletal system, your tendons, muscles, structures that are under the skin there. That can be helpful for making a diagnosis and finding out what the actual problem is, and that can also be helpful for looking at doing interventions, injections, and some other modalities would be PRP or platelet-rich plasma injection, or a percutaneous tenotomy, some procedures that we also will be offering. So thank you for your tuning in and listening to me today. I also wanted to thank our IT and marketing departments for helping make this possible. But now we have some time for some questions.
Okay, thank you, Dr. Finn. Very informative. And yes, we do have some questions that have come through. So the first question is, it seems that my endurance has gone down since returning to the gym after 3 months. Is there a good way to get this back quickly?
So there's not going to be a way to necessarily get it back quicker without increasing your risk of an overuse injury. If you have some event, say you're training for a marathon, or you have a competition that you're trying to prepare for, and you really, time is a sensitive issue, I would recommend talking with a trainer, athletic trainer, or a strength and conditioning coach for more guidance there to avoid potential pitfalls. But otherwise, it really is best to, like I mentioned at the very beginning, start slow and gradually increase. If you feel like you're doing really well at the low volume of exercise that you start out, you could progress that potentially a little bit faster, but still really pay attention and listen to your body. If you're starting to get any aches or pains, that might be a sign that you're pushing it a little bit too hard. But those adaptations do take time. There's not really a way to speed that up more than what your body can handle.
Okay, the next question. I see people using foam rollers at the gym. What are the benefits of using one of these?
That can, you can use those to kind of roll out tight muscles, kind of with stretching, breaking up adhesions that can kind of form, working on tender points that you might have in your legs or back or arms or chest. Like I mentioned at the beginning, kind of preparing to do your exercises and stretching, opening up that chest, working on stretching out those hips. That would be something that you could use a foam roller for. There's lots of different ways you can use them online. You can find a lot of different resources for that. But I would use that, kind of incorporate it into your either stretching routine if you're warming up, or kind of the cool down and working out some of the tight muscles or aches and kinks that you might be getting while you're starting your exercises.
All right. Another question. Do you advise stretching before and after a workout?
So that depends on what your goals are. Stretching, there's a little bit of controversy with it on how much you need and if you need it before or after. It does seem to decrease your performance a little bit if you're doing it beforehand. So if it's really important that you are potentially jumping as high as you possibly can, or having as much power as you can with that muscle group, say for a competition, or trying to set some personal record, you might not want to do very much stretching ahead of time, and you might want to focus that more at the end. Now, if it's a little bit like I mentioned before, where you're just kind of preparing to do your exercise and you've been pretty inactive, then I would recommend doing it before. If you're going to be running and you've been sitting for the last 3 months, open up and stretch those hips so that you're not running hunched over with poor posture during that run, and that will make you perform better. So when you should do it and how much you should do it really depends on what you want to be doing, I guess.
Great. One more question. How can you tell the difference between feeling the burn and overdoing it?
So that is a little bit of a hard thing to tell sometimes if you're not used to exercising. You can just have post-exercise muscle soreness that can be a sign you're maybe pushing yourself a little bit hard. But if it's something that feels out of proportion to what you're used to feeling with exercise, that would be a little bit of a red flag for me. If you are getting a lot of swelling in the area, if you're getting weakness in the area, if you're feeling sick, nauseous, feverish, those would be signs of a bigger problem. Or if you're really overdid it, sometimes you can even see color changes in your urine. So those would be, I guess, the red flags that I would watch out for. Out of proportion pain, swelling, weakness, or starting to notice your whole body is feeling different or run down, not feeling right. So again, it's part of kind of listening to your body. If you've exercised before, you should be a little bit familiar with what a normal soreness feels like if you got a tough workout in versus what is a little bit unusual.
All right, and we did have one other question come through. What is the importance of adding strength training to my workout?
So that's a very good question. Strength training provides a lot of additional benefits to just aerobic training. That is, it's also contributing to your cardiovascular fitness. There have been studies that shows that it can even decrease the risk of chronic diseases and even cancer. It also helps to build bone density, and it can even help with things like arthritis, and just besides the normal benefits of having more strength for your daily activities, and potentially if you're strengthening your core muscles, for example, you're taking some of the strain off of your back, and so you could be also decreasing your risk of other injuries. So yeah, that's a good question.
Great. So can you tell our audience how they can access care with you at the Mankato Clinic?
So you can basically just give us a phone call here at the clinic and ask to be seen or scheduled with sports medicine. If you are already seen here at the clinic, I also take referrals from our different providers here and therapists, but you don't need a referral. You can just give us a phone call and get set up with an appointment. We'd be happy to see you.
Great. And just for our listeners, you can call 507-625-1811 to schedule an appointment with Dr. Finn. You could also go to our website, which is www.mankatoclinic.com, and search for Dr. Finn there. We'd like to thank all of you for joining us today. This is our inaugural webinar, so thank you for joining us for our very first edition. We hope to have Dr. Finn back to talk about other topics. Thanks, everyone. Have a great day.
Thank you very much.